All right, good evening, everyone. Thank you so much for joining us this evening. My name is Dr. Andrea Ryan. I am really thrilled and pleased to introduce you guys to Tammy Gouweloos tonight, a registered dental hygienist who I've known now for, we're dating ourselves, but my daughter's 13, which means we've known each other at least 12 and a half years, or somewhere around 12 years. We met years ago. For those of you who do know me, I was a practicing chiropractor in Barrie for a number of years. My husband still practices chiropractic. We owned a chiropractic, family-focused practice together. And the first recollection, although we were discussing it earlier, I may be a little bit off on this, that I have of Tammy or meeting Tammy was at a health show when we were both starting to build our businesses. And Tammy is a phenomenal resource in our hometown. For anyone that, I mean, I have picked her brain, which I don't love that term, but I've picked her brain on so many different topics, ranging from breastfeeding to, because of her associations with La Leche League in the past, to homeschooling or unschooling, and to nutrition, and of course dentistry, which is where we take our three kids, and myself, of course, I get my teeth cleaned. She gives me a hard time about not nearly flossing as often as I should, but I just am such a valuable resource for myself and my family, and I'm so super grateful to have you here tonight, Tammy. Thank you so much for joining us. I appreciate it. And
thank you, Andrea. It's a pleasure.
Oh yeah, absolutely. So why don't you tell us a little bit more about your background and history? I know I have just kind of given you a little bit on how we met, but I'd love for you to sort of give us more about how you got into dental hygiene, and more specifically going the holistic approach, if that's all right with you.
Sure. So I was a mainstream dental hygienist for about 15 years, and then I became a mom. And what I found, as soon as you become pregnant, your decision-making changes very quickly into, I think, more heart-centered decisions. And I've always asked questions. I've always been curious about why we do the things the way we do them. And when my daughter was born, my first daughter, I did get involved in the La Leche League. I had a lot of very unique moms and families that did ask questions about everything from homeschooling to vaccinations to mainstream medications, bottle feeding. And then in my own practice, I had a lot of clients ask me about certain things in holistic dentistry I didn't even know it existed. So when I opened my own practice 13 years ago, I started taking conferences and courses on holistic or biological dental practices. And then I became a holistic nutrition practitioner, which answered a lot of questions. But still to this day, I'm learning, and every client that comes in, I learn more from them and they learn from me. So it's great.
I love that. And it's so true. We've had lots of conversations that have gone far beyond are my teeth clean, right? And that's what we typically associate, of course. I feel that when we go to the dentist, we're there just to talk about teeth, but you take it so much further beyond that. And we really dive into fascinating topics. Although I always feel goofy because, you know, when you're trying to talk to someone while they're brushing or cleaning your teeth, you just, I don't know how clear I am, but you managed to understand me, which is lovely. So can you maybe give a little bit more of an understanding the difference between conventional dental hygiene and then looking at it from a holistic, or I love that word, biological approach?
Yeah. Okay. You know, most people go to a regular kind of mainstream conventional dental office, and I guess my approach is more whole body. I look at nutrition, I look at emotional health, I look at stress levels, because everything's connected. The mouth is not separate from the rest of the body. And anything we do to the mouth, you know, procedures or products we use get absorbed into the body immediately. So I try to use non-toxic, try to use least invasive techniques. And yeah, it's really been a fun journey for sure. So that's kind of the difference. And it's up to the client too. We work together to figure out what their needs are, and come up with a plan to create a great oral health, and that is connected to the body health too.
Awesome. And so what if, like, when people are coming in, and as I mentioned, we've taken our kids there since they were born, or since they were able to have teeth. So can you kind of give an outline from a perspective of not just in terms of when kids should get their teeth checked, but then also maybe timelines or something along the difference? Like we've always just been taught, oh, every 6 months, go get your teeth checked, which may be well and good. But from your perspective, what are some red flags or maybe concerns that parents should be aware of, and not just for kids, of course, as adults too, because I get my teeth cleaned.
Yeah. Well, hopefully moms are looking in their children's mouths when they're brushing and checking. And for children especially, I like to see them, anytime around age 2. But I have a lot of moms that send me pictures of babies' teeth as they're coming in, if there's any concerns. So always just looking for yellow spots, brown spots that don't come out. Food traps. If children don't like certain foods, like cold things, or food gets stuck, those are all kind of red flags that maybe something's going on. And so when they come in, we try to talk about the root cause, why it happened, and prevent further issues, and see if we can do some healing in the gums or the teeth, if possible, with nutrition. But it is hard work to be healthy, as you know. Yeah, I'm not sure if I answered your question, but.
Yeah, for sure. And I mean, to your point, one of the things that I love is when we come in, I mean, you'll start by kind of coming along the jaw and checking our lymph nodes and so on. So it really is a full body approach. I mean, you'll pick up on things that my kids might be fighting or have been fighting or are recovering from, or just simply ask, just based on your checking tongue. And I don't know all the reasons why, but you're just sort of always giving us these little tidbits and so on. So I totally respect that, because similar to chiropractic is that a lot of people tend to pigeonhole chiropractic as, oh, you guys are just back doctors, but we're not. We're so much more than that. We're a nervous system, we're brain and body connection, and we look at the body as a whole, knowing that when we have, if we're taking a medication or a supplement, or if we're approaching a health from a nutritional standpoint, it does impact the whole body. It's not just take this, fix this, right? Like it's a whole body approach. So I love that.
Yeah.
So we talked a little bit briefly about what we wanted to approach tonight, but can you talk to us a little bit about the basic dental health tips or suggestions that people should follow from a holistic perspective?
Sure. I think most important is just really great nutrition over even brushing and flossing. Picking whole foods. I know one of the original books that kind of blew me away was Weston Price, Nutritional Degeneration. And he was a dentist back in the 30s who traveled the world because all of a sudden he was seeing these children with narrow jaws, the teeth didn't fit in, all this decay. And so he traveled around the world and found isolated communities that hadn't had processed foods yet, or access to processed foods. And he found as long as they were eating their ancestral diets, they still had the nice wide jaws, they were nose breathing, there was enough room in their mouth for their wisdom teeth, they were chewing more, and they didn't have cavities. But as soon as they got introduced to any processed foods, their jaws would narrow within one generation. They didn't have enough room in their mouth for their teeth. The wisdom teeth needed to be extracted. They had cavities, and they also became mouth breathers. So there was a huge shift, and it's due to the type of food we're eating. And even today, I encourage moms and dads to, and even for themselves or for their children, to be great role models and just eat whole foods, like eat an apple, like eat real foods, nothing in a package if possible. And children are eating out of packages, like that's just the way it is. And then, so moms will come in, oh, I don't know why there's cavities. And I'm going, well, and it starts right from conception or even before conception. So I want to get pregnant moms in, or young moms, even a year before you get pregnant, you've got to get your body nutritionally healthy. And try to reduce processed foods, take some supplements if you need to, eat nutrient-dense foods, and then get pregnant. And same with dad. Dad has to be Dad has to be healthy too, right? And it's so I believe that the baby teeth, the health of the baby teeth is determined a lot by mom's nutrition during pregnancy, her stress levels during pregnancy. And then, of course, the first year of breastfeeding. The longer the child can breastfeed, it helps the development of the mouth, the jaws fit better, And of course, the immune system, there's a bazillion things I can talk about breastfeeding, but mom's nutrition has to be optimal while she's breastfeeding to make sure the breast milk has all the ingredients that the baby needs to develop healthy teeth. I can't hear you. I can't hear you. Oh, shit. Sorry, Andrea, I can't hear you.
Sorry, I was muted. My apologies.
Yeah.
So I could go off in like a million directions based on what you were just saying, and because just you had so many gems there. But two things that you'll put some attention to, and if maybe you could elaborate on the difference between mouth breathing and nose breathing.
Okay, sure. That's huge. And that's what I've just been my passion the last 2 years. I became an orofacial myofunctional therapist. So that's all about retraining the lips and the tongue, and just the swallowing practices, the breathing practices. Because what happens is when children, even babies, have their mouth open, so the only time our mouths should be open is when we're talking or eating. And that's actually just placing food in our mouth. We should be chewing with our mouth closed. So what I'm seeing is a lot of children who are mouth breathers, they tend to grow a narrower jaw, especially in the palate. They often need to have teeth taken out for braces. So how we breathe affects how we grow. It affects our health of our whole body, because our nose is fabulous. It filters the air, it humidifies the air, gets it to the right temperature, it determines the velocity of the air. Plus there's cells that line the nasal passages that actually kill viruses and bacteria as they come in. When you breathe through your mouth, none of that happens. So basically you breathe through your mouth, with all this corona crazy virus stuff going on. Our nose can filter that stuff out if we use our nose. So, but when we breathe through our mouth, what happens is there's no filtering, so it goes right from our mouth into our lungs, directly into the bloodstream. So the body's working really hard to fight that. So often you'll see children with enlarged tonsils, enlarged adenoids, because they're mouth breathing. So it affects so many things.
And are there tips on how to, obviously we've talked a little bit about it, of course, but with the designation that you just mentioned, and with the oral, I can't even remember.
Facial, yeah, yes. Oral facial myofunctional therapy, yeah, or OMT for short.
And if you're noting that with your kids, that's something that you should be finding someone within that designation to help out with.
Yeah, or you can find a lot of great information online. All you do is you could even just YouTube or search mouth breathing versus nose breathing. But encourage the children to keep their nose clean. We tend to kind of just to get them to blow once in a while or whatever, but really keep that nose clean so that they can breathe. And encourage them to keep their lips sealed during the day, unless they're talking, even when they're chewing. And of course at nighttime, sneak in on them. If the children are making any noise at all, unless they have a really bad cold, there should be no noise. We shouldn't snore. We shouldn't, make funny noises. Our lips should be sealed, tongue in the roof of the mouth, and sleeping soundly, hopefully, all night.
Awesome. Beautiful. Okay, so I want to ask the question because I know this is, and I know a little bit about it, but not nearly enough, but this is hands down one of the more popular questions that I get, because when we talk about the dental, so even when we're introducing toothpaste, when to introduce toothpaste, and then maybe types of toothpaste, because of course, and we hear it, that comes up in the media all the time, is the whole fluoride debate. And I know, we can't go into a ton of detail on it, but what would your perspective be on that?
As far as any oral health products go, I wouldn't recommend using anything with children until maybe the age of 3, but as soon as they see you putting something on your toothbrush, they're going to want to put something on their toothbrush, right? Because they just mimic what we do. So it's important for us too, backing up, to keep our lips sealed and breathe through our nose, because they're going to mimic what they see. Children are wonderful for that. And as far as toothpaste goes, the reality of toothpaste is that it's not regulated by any industry like FDA, Health Canada. It's not regulated at all, which translates to they can put any ingredients in and they don't have to be tested for safety. The moment you put anything in your mouth, whether it's mouthwash or toothpaste, you instantly absorb it through the tissue. So you want to make sure you're putting anything in your mouth or your children's mouth that's safe. So I always say, read the ingredients. If there's a poison center sign on it to do not swallow, put it back on the shelf. Do not buy it. Because the moment you put it in your mouth, you're going to absorb it. So I have a lot of clients that make their own toothpaste. You can look online again for that. Just simple, coconut oil mixed with some essential oils, a little bit of calcium bentonite clay, activated charcoal, a little bit of baking soda. It's fun with kids too to make their own, little jar of whatever. But yeah, you really got to read the ingredients because most ingredients in toothpaste are not good for you.
I totally agree. So you mentioned a few of the different ingredients there. So bentonite, I'm familiar with them, but could you maybe sort of give the details on what does the clay do? What does activated charcoal do? The purpose of baking soda, etc. Coconut oil, you mentioned essential oils, just so that people know why.
Yeah, sure. So coconut oil is a very safe kind of carrier or ingredient that is good to mix things into, and it gives you more of a texture of toothpaste. Of course, the moment you put it in your mouth, the heat of your mouth will, dissolve it a bit. But it can make it a nice creamy toothpaste. And coconut oil, a lot of people will use coconut oil for oil swishing or oil pulling. And that's wonderful for just reducing the bacterial load in the mouth and in the tonsils and in the nose. So that's kind of a cool, it's actually started Ayurvedic technique with raw sesame oil. But, and the calcium bentonite clay is wonderful because it helps pull out toxins. It, as it travels through the body, it grabs onto viruses, bacteria, parasites, heavy metals, and then basically you just poop it out. So that's kind of cool. Activated charcoal is, again, activated charcoal should be in everybody's medicine or first aid kit, I guess. It's great for poisonings, but it actually is wonderful in that it helps whiten and remove surface stain. So that's why I like the activated charcoal. And again, it's safe to swallow. Baking soda, you only want to use a little bit of that because it is a little bit more abrasive, but you can put a little bit in, that's fine. And then of course, the essential oil of your choice. I really like the Blend on Guard. Using cinnamon is good. Cinnamon is a hotter oil. Same with peppermint, they're hotter oils. So you want to really dilute them. You don't want to add too many drops. And cinnamon, as you know, is antibacterial. Peppermint's great for just flavor too, spearmint. There's so many great oils out there you can use.
Yes, my kids like adding wild orange because they love the orange taste to it. So that's what they'll add in. The bentonite clay, by the way, and I'll speak to not the bentonite clay, the activated charcoal, we'll take it whenever we go traveling as well, because you just never know with stomach upset what we'll get. So you can get them in the little capsules, but I use it on my toothbrush. And again, I learned this from Tammy, is because I have a tea stain on my one of my teeth that gets quite dark. And as long as I use the activated charcoal in a powder form right on my toothbrush, it's real sexy when you see it because it looks just all black goopy stuff in my mouth, but it really does clean it out and it brightens your smile. So it's definitely, it freaks you out when you first use it, but trust me, it's once you get it all cleared out, it's definitely worth it. So you mentioned, we talked a little bit about gut connection as well in nutrition. Can whole foods maybe sort of give, I know obviously with your background in holistic nutrition and eating the whole foods, not just good for dental health. I remember we had a conversation once about sort of this fad with everyone drinking their meals instead of eating their meals, and the whole purpose of mastication and so on. It's all important, but not to sum up all holistic nutrition in under a couple of minutes, but a couple of tips in terms of maybe eating and solids and looking at different ways, or not necessarily different ways, but good nutrition choices for good dental health and gut connection. Sure. Because I know a lot of families will use smoothies, which are fabulous, because that's a great way to get veggies in our kids' a kid's diet. But I would say always leave the smoothies a little lumpy and so that there is some chewing action.
There's another book I have here called Jaws that I just read in the last year, and it's written by a anthropologist and a dentist, which is an unusual combination. But what they did is they looked at jaws throughout time, you know, human jaws, and realized that in the last probably 300 or 400 years, we're not chewing kind of as much as we were. So therefore, our face shapes are changing. Our jaws are narrowing and shortening. So always encourage your children to eat raw veggies, raw fruit every day, and encourage them to chew. A great exercise is to just get them to put a small amount in their mouth, lips sealed, chew at least 20 to 30 times, really savor the flavor, the crunchiness, pause, and then swallow. Because we have a tendency, and even as a family, we're all together at the meal, we're yakking, we're, you know, talking with our mouths open with food in it, and then we tend to not focus on the actual chewing, and we'll end up swallowing too soon, and then we'll kind of force it down with a drink of water or, you know, whatever. So we're forcing the food down because we haven't chewed or masticated enough, and then we have to force it down with water. So that's terrible for digestion, absorption, and then elimination, you know. So just chew, chew, chew.
It's so true, because when you think about it, I mean, if you're the amount of energy that your body needs to use in order to digest non-masticated, or, you know, the food that hasn't been broken down by our saliva, by our teeth, etc., is massive. So yeah, of course you're going to have less absorption, and then, my goodness, no wonder there's such a high rise of or higher rates of digestive issues in terms of, I mean, constipation on the low end, but then also, of course, there's so many other gut issues that we see nowadays. So it's I think we sometimes, again, when someone hears that they have a health concern, they don't go, you know, they look to treat that health concern versus saying, okay, well, where did that come from? Which is how you started off the conversation, is to always look back to the cause of the issue to begin with.
Yeah, the root cause. Yeah. And I also look too, you know, when children come in with decay, it's like, you know, what type of, like I had a young gal in today, and she's got, you know, a whole bunch of cavities again. And I was talking to mom, and she says, well, she doesn't drink pop. And I said, well, does she like her carbs? And she goes, yes, she loves her fish crackers. And I'm like, okay, I want her, she's 10 years old. I want her to look at the ingredient list and see which number or how many times sugar, fructose, glucose is in the list. Because every time she eats those, then they stick in her teeth. And they're not a real food. So give her an apple, give her a banana, give her some grapes, you know, so, but it's so convenient to give them packaged foods, right?
Yeah.
You know, so.
It just takes a little bit of extra work on our part, right? To prep ahead.
Yeah. And you know, do the, you know, spend an afternoon prepping a whole bunch of stuff for the whole week, right? And that's beneficial. But I know you mentioned earlier about the gut connection. What I find is a lot of young children have been on antibiotics because of ear infections, or you know, strep throat, different issues. So as soon as you change that microbiome in the body, it affects the teeth right away. So you know, I always encourage parents to either get their children on a probiotic to get re-inoculated. But also too, you know, years ago, hundreds of years ago, when we didn't have refrigeration, you know, there'd be many cultures that would eat just a little bit of fermented foods, right? With their meals, because they didn't know if the meat was going to be okay. So they covered up, you know, that possibility by having a little bit of fermented foods. So if you're not keen on probiotics, just have a little bit of fermented foods with your meal, or a little bit of fermented drink, but not to overdo it. With fermented, I know a lot of people, they'll buy kombucha and drink, and next thing you know, it's too acidic for their teeth, and they have sensitive teeth. So, yeah.
And so fermented foods, you're talking like kefir and pickles, sauerkraut, whatever.
Kimchi. Yeah. And all you need is a little bit, you know, to re-inoculate the bacteria load. And I mean, if you're drinking chlorinated water in your homes, you're going to be reducing the good bacteria in your gut. So you do have to re-inoculate with, you know, some good bacteria again. So that's why it's great to filter your water if you can.
Yeah. One of my favorite statistics, which a lot of parents don't realize, is that, or it doesn't even have to be a parent, because adults get put on antibiotics all the time as well, is that it can take studies show anywhere between 18 months to 2 years of daily probiotic or fermented use of, I love probiotics, so I always go to probiotics, to get your normal gut bacteria back up to normal after a series of antibiotics or a full course of antibiotics. And it's such a crucial component of our health. And we always hear the people praise the benefits of antibiotics, which is a whole other topic, but we don't hear about, well, what do we do after the antibiotics? And not just antibiotics, stress can reduce it. And when we look at the number of C-sections now compared to vaginal births, that has an impact on our gut flora. I could speak for hours on that. I just love the
or
topic.
babies. Yeah.
Totally.
Yes.
Awesome. Thank you. Is there so best, before we open it up to Q&A, oral health products, we talked about a little bit about toothpaste. Is there anything else that you would suggest for people just in general to have, for stuff that they can be doing on a daily basis or a weekly basis, or what sort of things they should be using?
Well, water picks are great if you have room on your bathroom counter for them. It just helps flush any food particles away if you can't get into the flossing. I guess, even warm saltwater rinsing can help reduce bacteria load. Something as simple as that. You don't have to spend a lot of money, buy all these, mouthwashes and toothpaste. There's a lot of really simple, easy things you can do. Old remedies like a warm water and sea salt together, just swishing that for 30 seconds to a minute can reduce the acidity in the mouth, create an alkaline balance. And the bacteria usually cause problems in the mouth, love an acidic environment. Okay, so the more you can be alkaline in the mouth, the better. I would say I have a lot of women who do apple cider vinegar and lemon water. I just worry about that on the enamel in the teeth. So often, rinse after with just alkaline water. Again, a little bit of baking soda, a little bit of sea salt in the water. That's pretty important. And there are some great toothpastes and mouthwashes out there. But always read the ingredients. Make sure they're, things that you want to put in your body. And I know we talked a little, I don't know if we talked yet about the fluoride issues, but there's some great research on there that fluoride maybe isn't good. It changes the matrix in the enamel, so it appears to make it denser and harder, but it has so many problems in other parts of the body. So dentistry just has a very kind of narrow viewpoint, and they look at what it does to the teeth, but it can replace iodine in the thyroid. It can calcify the pituitary gland. It can have kidney issues. So, and they can't control the amount of fluoride you're getting. If you're getting it in toothpaste, in water, in mouthwash, so it can be pretty toxic for the body.
Yes, absolutely. I mean, we've been fluoride free the kids' whole lives, certainly, and just because of that, and I know that it does create a bit of a debate there, but it's certainly something I think people need to educate themselves on to recognize. I mean, we could, again, speak on that alone for a couple of hours, but I just think that there's so much misinformation out there, and we really just have to dive a little deeper. And,
Yes.
We say all the time, there's so much information out there that we have to educate ourselves and really look at the sources from where the information is coming from, and then decide for ourselves what makes sense.
Yes.
Yeah. You had mentioned some resources, before Q&A, you'd mentioned the book Jaws, and then there was another book that you were going to...
Yeah. So, there's so many books. Nutrition and Physical Degeneration, that's the book from Weston Price, and it's got great photos in it. That kind of blew me away, that book. Actually, an Ontario gal, Holistic Dental Care, Nadine Artemis, she has some great oral products. If you don't want to make your own, she has some good ones. She's from Living Libations, and she works a lot with essential oils too. And she looks at all the different ingredients you can put in toothpaste and mouthwashes, and she's got a regime, and salt water is one of hers. So that's another great book. So Andrea and I will make sure you have the list of all these books. And then so Fluoride Deception, that's a fabulous book. This guy's an investigative reporter. And he did his homework, like crazy homework. Wonderful book. If you want to get right into the fluoride debate. Another one that I've really been interested is a lot of moms have trouble with babies breastfeeding, and nobody knows why. And sometimes it's tongue tie, tongue restriction. So now I'm educated on that, on how to identify and how we can work through that for moms and even toddlers and parents alike, because it can cause breathing, snoring, and sleep apnea issues. So that's a whole another topic. Yeah, oh, and then this one here, it doesn't have the cover on anymore because I wore it out, but it's called The Dental Diet by Stephen Lin. He's kind of the second priest. He's an Australian dentist. He's done amazing research. This is a fabulous book for any families. They're having issues with decay and want to know why. Fabulous book called Diet by Stephen Lin. So we make sure everybody who's here will get these names and books and authors.
Awesome. Thank you, Tammy. Okay, guys, so in the last few minutes, I just want to open it up to Q&A. Does anyone have any questions for Tammy with regards to what we've chatted about, or perhaps something that's been on your mind that thought, you know, you'd love to get a professional's opinion on it? And if not, that's okay too. Tammy, can you give us your website and how to get a hold of you? Not everyone here is going, I know for a fact not everyone's from Barrie, but there are a few, and we'll be watching the recording as well, or how they can get a hold of you. Or if not in Barrie, I know, for example, Debbie's in the Ottawa area. How do we find a local, like a holistic dental hygienist?
Okay, so my website is barriedentalhygiene.ca. I also have a new website we've just launched called breatheomt.ca, and that's all about breathing function, lips and tongue, and just all kinds of fun stuff. So my daughter and I, we just launched that website. And but I also, with the OMT, the oral facial myofunctional therapy, I can do that virtually. I can do assessments virtually, and I can give advice and exercises virtually. So that's kind of cool. And there are several hygienists actually, and there's one in Kingston, there's one in Midland, and there's another gal in Smiths Falls. So that's kind of near Ottawa. So there are gals in Ontario that have figured this out, which is fabulous. And there are, you know, several in the United States. There's quite a few connections. But, you know, as I said, does everybody do your own homework and do with what feels right for you in your heart as far as decision making goes? But there's lots of great information out there.
That's awesome. Tammy, thank you a million times over. I really appreciate this. I know I never tire listening to you and learning from you, and I really, really very much appreciate it. Thank you so much.
Okay, thank you, Andrea.
Well, Patricia, I'll get back to you with some locations with that if we can find one for you, okay? Awesome. All right, guys, thank you so much. I appreciate you joining us tonight, and email will go out with the recording for this tomorrow. All right, guys, thank you so much. Have a great evening.